Hi, I'm Shamika Montgomery. I am the clinical nurse educator at Deborah Heart and Lung Center. This is a strategic plan for Deborah Heart and Lung Center's operating room for my Grand Canyon University course in leadership 620. The objectives of this presentation is to establish the mission and values of Deborah Heart and Lung Center, describe the goals, recognize the shareholders, review the strategic map, understand the strategic plan, and to evaluate the process. Here is the mission and vision of Deborah Heart and Lung Center. The mission: to provide the necessary facilities, equipment, medical staff, and financial resources required to deliver the highest quality inpatient and outpatient services for the diagnosis and treatment of heart, lung, and vascular disease within a center's service area. The vision: Deborah Heart and Lung Center will continue to be the premier provider of cardiovascular and pulmonary services in the region. We'll be known for excellent clinical outcomes and for supreme customer-driven service, and as the ultimate leader in patient safety and privacy. We will continue to partner with other quality providers and payers to ensure a seamless continuum of care to the patients we serve. We will continue to improve both service and quality in the most cost-effective manner. Here's some history of Deborah Heart and Lung Center. This is an 89-bed hospital in a rural area, New Jersey. It's currently 2 clinical educators for all medical units throughout the entire hospital. So the operating room has never had a clinical educator. There are 5 operating rooms. Some of the staff consists of 15 nurses, 4 scrub techs, 4 OR attendants, along with other support staff, such as anesthesia team, perfusion, etc. So the goals being established here for this strategic plan is to first communicate the new role of the clinical nurse educator, to improve communication regarding staff, education, and standards of practice, and to establish the clinical nurse educator's role of holding staff accountable for learning new equipment, policies, and procedures. The reason I chose this goal is because of Deborah Heart and Lung Center's history. They have never had anyone hold staff accountable for education. The manager was responsible for all education for staff. So there hasn't been a continuum manner of education and care. So this new role will be stepping into new shoes and learning how to get this team to work together to exemplify the standards of care expected from the institution as well as their governing bodies. Some of the shareholders consist of the surgeon, the assistant surgeons, the anesthesia team, such as the CRNAs and SRNAs. Management is director of nursing, the manager of the OR, and the newly appointed assistant manager. The nursing team, along with the charge nurse, the scrub techs, perfusion, and OR attendants. So here's a strategic map for these goals and for this plan. So the learning and growing goals are to communicate the role of nurse educator, promote learning with ongoing training of equipment and supplies, reinforce and educate ARN standards in conjunction with policy and procedures, communicate education, information, and resources as necessary via email and being accessible on the operating room drive, plus being printed out and available on the unit. Internal business process goals are to start a relationship with the new leader and the staff, continue to build relationships with the vendors, allow reassessment and revision of policies and procedures to align with accreditation standards, and to provide multiple ways to access information for streamlined care. Customer service goals include building and maintaining a relationship based on trust and value information between the clinical nurse educator and the staff, to build and maintain a good customer relationship between the staff and vendors, influence the team to work together towards the same goal and expectations, and this allows patients to have an expected level of safe, quality care. Some financial performance goals are to reinforce processes that prevent liability, to utilize products at reduced pricing, improve work environment to encourage staff retention, and to increase accountability, efficiency, and safe practice. So this continues with the strategic plan for that MAP. And it's to communicate the role of the clinical nurse educator in staff meetings and reinforce with email. And this is to introduce the new role, to let everyone know what the expectations from the educator is, as well as with the staff. To build and maintain a relationship based on trust and evaluate information with continuous and direct communication. And this just sets a streamline of information from the educator to the staff, making sure that everything is aligned and making sure that the information is continued between everyone. To influence the team to work together towards the same goals and expectations with consistency of standards of practice. And to provide multiple ways to access information for the streamlined care. Again, that's email, being on a computer drive, printed out, in binders on the floor, on the communication chart, in the communication log. Various ways that we can communicate besides face-to-face to make sure that education is being given throughout the entire staff. Another part of this plan is to promote learning with ongoing training of equipment and supplies, and staff will sign off on all education. And this is to hold the staff accountable to make sure that they are taking advantage of the education, that they are sitting, that they receive the education, and that they will continue to ask questions to make sure that they can safely operate this equipment or any education given for quality patient care. Another step is to reinforce and educate ARN standards in conjunction with policy and procedures, and to allow reassessment and revision of policies and procedures to align with accreditation standards. All of this is just to make sure that we're aligning the standards of our governing bodies with the expectations of the facility, Deborah Heart and Lung Center, and so that they're being carried on through our staff. We want to make sure that the staff understands what is expected of them, and the educator has all the information that she needs to provide to the staff, and to work together as a team to make sure that the ultimate goal, that our patients are receiving the quality patient care that they deserve. Now, to evaluate this process, there are a few steps. There will be monthly meetings the first Thursday of the month. And this will be used to just continue any education requirements, any emails that were passed along, any issues or concerns that might have occurred, any education or thought that the staff may have, and just to keep the flow of communication going. There will be an evaluation of all in-service education, and this is to make sure that the education was received, that it was understood, that the staff has anything they want to say as far as what they would have liked to have learned, any suggestions for going forward. And there also will be variance reports completed. And this is already the expectation from the staff. If there's any policy interruptions or any unsafe patient services being provided, that this is being reported in our system so the data can be pulled. And then it can deduce if any process changes are needed or just education is required. And this is done throughout the hospital, but especially in the OR, just making sure that this can help facilitate the way education is needed. And then lastly, daily reinforcement of standards as needed. This is correcting any improper or poor technique that's happening, any changes that need to be made at that time. Daily, the educator, as long as staff, will be making suggestions and reinforcing the standards of practice. So everyone has a hand in this and making sure that our team is providing and acting accordingly as expectations will be stated. So that is the end of our presentation. I thank you for being a part of this new role and going forward with the vision of the operating room. I would love to think that going forward that we will all work together to make sure that the educator is able to positively enforce the standards expected and really make a good impact on the team. And the team also be very welcoming to the changes and the support that we'll be receiving going forward. If there's any questions or concerns, please feel free to reach out to me, and I would love to take care of them for you. Thank you.